Do you know what the difference is between mental health and mental illness? In this video, I'm going to talk about a model that helps to clarify that difference. I think it's great that there's a lot of discussion around this topic, but I think we've done a bad job of clearly defining the difference. I'm not one who gets too caught up in the use of language, but I do think it's important to understand these concepts clearly. I think our lack of clarity around the big differences is a reason why so many people are presenting with mental health problems. So this is the dual continuum model. On this axis, we have mental health. If you have a brain, you have mental health. On any given day, we can experience good mental health. Generally, that means we're doing the things we know are good for us. And nothing random has happened to throw that off. On any given day, we can experience bad mental health. And this is generally because we're not doing the things that we know are good for us. And in a lot of circumstances, life throws things at us that we just can't plan for. And that causes stress and anxiety and all kinds of other normal things. But generally, those things balance out. So it really depends on a bunch of factors. We go up and down all the time. On the next axis, we have mental illness. To have a mental illness, you need to be diagnosed by a doctor, not by a Google search. Mental illness lives on a continuum the same way mental health does. Some mental illness can be considered minimal. These tend to be ADHD, depression, general anxiety disorder, and some mental illness can be considered to be more severe. These are generally things such as schizophrenia, bipolar disorder, major depressive disorder. So for the record, I think we could do a better job of diagnosing mental illness, and that people's experiences are much more complex than we tend to acknowledge. The diagnoses are helpful when they are used as a tool to understand your problems so that you can learn to heal from them. What this model is trying to show us is that whether or not you experience severe mental illness or minimal mental illness, you can still experience good mental health. And this is really important for people to understand, and it should be the expectation for people when they enter recovery. Got any thoughts, ideas, questions about this stuff? I'd love to know, and I'd love to, interact with you. You know the deal. Please comment, please subscribe, please like, share, all that good stuff. And, if you want to support me and even be a little more brave, head on over to Patreon, show a little love. All right, thanks. Peace.